Hi, everyone, and welcome to the American College of Sports Medicine Greater New York Regional Chapter podcast. Today we have an amazing guest, Dr. Anthony P. Kontos, and we'll be discussing concussions. Dr. Anthony P. Kontos is Research Director for the UPMC Sports Medicine Concussion Program and Professor in the Department of Orthopaedic Surgery and Sport Medicine and Rehabilitation at the University of Pittsburgh. He has specialized in concussion research for 18 years with over 220 peer-reviewed publications and over 390 professional presentations. His research is funded by Centers for Disease Control and Prevention, Department of Defense, National Institutes of Health, and National Football League, and focuses on active precision treatments in clinical trials, risk factors, neurocognitive, neuromotor effects, psychological issues, and concussion in military, pediatric, and sport populations. Dr. Kontos is fellow and past president of the Society for Sport, Exercise, and Performance Psychology at the American Psychological Association and fellow of the National Academy of Kinesiology Association for Applied Sport Psychology and Eastern Psychological Association. He also co-authored with Dr. Collins, Concussion, a clinical profile-based approach to assessment and treatment. Dr. Kontos, thank you so much for joining us.
Thanks, James. It's a pleasure to be here.
Yeah, pleasure to have you on. So let's just start at the very tip. You will be presenting at our spring conference, and I'll announce that toward the end of the program. But let's just begin at the very basics. Please just give us a working definition of what a concussion actually is.
Yeah, so a concussion basically is caused by a direct or indirect force acting on the brain. So these forces cause what we refer to as a neurometabolic cascade, and that results in changes in blood flow in the brain, and it really causes like an energy crisis, if you will. As a result of that process, athletes experience a whole bunch of symptoms such as headache, dizziness, nausea, balance problems, and impairments like cognitive, visual, and what we call vestibular, which is integrating sort of sensory and movement information. We found through our research and over 20 years of clinical work that patients really present with one or more sort of profiles or subtypes following this injury, and those things kind of can be aggregated or grouped into things like anxiety, mood, cognitive, migraine, headache, ocular or vision related, and vestibular, which involves, again, as I said, the sensory information and kind of coordinating our body's movement.
So that's kind of broad. So if somebody does receive a blow to the head, the symptoms could be many, correct?
Yeah, I mean, we always kind of joke that if you've seen one concussion, you've seen one concussion, because they're highly individualized, and they really depend on a lot of factors. What happened during the injury, what was going on right after the injury? Did the athlete continue to play? Did they come out? And then importantly, which a lot of people don't really talk about or acknowledge, which is, what you bring to the table will drive a lot of what happens. So if I have, motion sickness or migraine history, that's going to drive me down a vestibular pathway or a migraine pathway based on kind of what I brought to the table before my injury.
Oh, interesting. So it could exacerbate a pre-existing condition, in effect.
Exactly. We kind of say concussion fights dirty. It magnifies what you already have, kind of picks at the low-hanging fruit, and often will exacerbate that and send you down that pathway. So again, if you're anxious, that's going to mean that you're probably more likely to experience an increase in anxiety following concussion than someone who wasn't anxious before the injury.
Wow, that's interesting. That's interesting. There are several different types of concussion. Can you kind of walk us through those?
Sure. As I mentioned earlier, we have really 5 types of concussion. There's anxiety, mood, which relates to things like being, nervous or having sort of sadness, irritability. We also have cognitive or cognitive fatigue, which is a concussion that has, problems with processing speed, memory, maybe a little bit more tired throughout the day, a little harder to function mentally throughout the day. And then we have migraine headache, which is really a bunch of symptoms related to headache and also nausea, as well as sensitivity to light and noise. And oftentimes those headaches are present early in the day versus the cognitive type headache, which might be more as the day goes on. We have ocular or vision-based concussion type, and that's really focused more on the eye's ability to move and integrate and change focus from near to far and track objects, things like that. And then the last one of the five types of concussion is vestibular, which involves things like imbalance, head and eye movement integration, our ability to sort of sense where we are in time and space and balance and walk and do things like that. And in addition to those, we don't really consider them subtypes, but we think they're important to consider. We kind of think of them as modifiers, and that's sleep disruption and also the involvement of the neck.
Of those, which ones do you see most? Which ones would qualify as being the most common?
Yeah, it's a pretty good split for the most common between anxiety, mood, and migraine headache. And we see each of those individual profiles or subtypes at around about 25 to 30% of concussions. And there are other types that certainly occur, and oftentimes they co-occur. It's kind of rare to have just ocular or just anxiety, mood. It's more commonly that athletes will present with two or more types, where one is kind of the primary issue, the driver, and then the other ones may be like secondary or even tertiary.
Understood. So let's say an athlete does receive a concussion, gets diagnosed as such. Approximately how long would it take an athlete to recover? I guess we don't have to make it an athlete. Anybody's susceptible to a concussion, right? But how long does it actually take to recover on average?
Yeah, that's a good point. It does affect everybody, not just athletes. A lot of the data we have are driven by, athletes who are kind of motivated to return to their sport or whatever their activities are. So we use those data a lot, but you're right, it does apply to everyone. And there is a misconception that, these injuries on their own will just spontaneously recover within a week or two. And that's from really early data that focused on predominantly football players. And to no one's surprise, they miraculously recovered within 5 to 7 days before their next game, right? but the reality is, we now know from some large databases coming out of the NCAA DoD Department of Defense CARE project, which looked at like 32 Division I and II and III institutions, that a collegiate athlete takes about 21 days on average to recover. And for adolescents in high school, it's even longer. It's an average of about 30 days. So if I'm a college kid and I'm at 22 days, that would be considered a longer recovery. And for an adolescent, if I'm outside of a month, that would be considered longer. And about 1 in 3 concussions takes longer than those average amounts.
So of the 5 types of concussions that you mentioned, are there some that will take longer on average to recover than others?
Yeah, there are. And to be totally honest up front, if any, not identified or treated early injury or profile can certainly persist. So that's important to note that, the sooner you get into care, the quicker resolution will happen through a combination of, behavioral management and targeted interventions. But if you take that kind of off the table, anxiety, mood, migraine, headache, and probably vestibular are the most likely to have sort of persisting symptoms that would last outside of those time periods I just mentioned. And anxiety, mood is kind of interesting in that a lot of people early on may not present with that, but it can come on later as the recovery process becomes more complex and athletes become more frustrated with maybe a lack of progress, or they're just not getting, proper treatment in a timely fashion.
In what, on average, what would be the longest recovery time for one of those categories?
We typically don't really keep track of that, but, anecdotally, definitely clinicians here at UPMC and the University of Pittsburgh, we've seen patients that can have recoveries lasting for months, and we consider chronic or long-term outside of like 90 days. That's the NIH definition. And we've seen patients come to us from other clinics that still have symptoms beyond a year.
Wow. Okay. So let's talk a little bit about the mental health aspect. Walk us through that. Like, how does it really impact net one's mental health after they receive a concussion?
Yeah, it's a great question and an important one because it's often ignored in regard to concussion care. And concussions can affect, mental health in a variety of ways. First, a concussion can just magnify, as I mentioned earlier, pre-existing issues. So if an athlete was anxious before a concussion, they're going to be more anxious afterwards. And second, concussion can result in new anxiety. So an athlete may, or an individual, a patient, may not have had anxiety before their injury or mood-related issues, but they come on after the injury. And these new symptoms can be directly biological from injury to the brain, or they could be a result of psychological issues associated with things like, a disruption in routine, or no longer playing their sport or doing their activity or job, being isolated or withdrawn from others. And frankly, for athletes in particular, like losing their spot on the team, and it's just in general being kind of frustrated by the process of injury.
That's fascinating. So let's then talk more. Let's take a deeper dive into the symptoms. So what are the most commonly reported symptoms, especially when it comes to the mental health domain, to dovetail off the first question? Like what are they likely to report? Like if you're a parent and you suspect your kid might have a concussion, what might they look for?
Yeah, I mean, when we take the mental health issues off the table, the most common headache is the most common symptom. And that's not surprising, right? It's a head injury. So,
yeah.
We see a lot of headache, a lot of dizziness, a lot of nausea. These are kind of early on symptoms that we see. However, we also see about 30% of the time we see mental health related issues, and that can be more in anxiety, things like being nervous. One that we often see clinically is constantly thinking about their injury, like, over sort of rumination, constantly thinking about their injury. They almost become their injury. It's their identity. They can be on edge, not sleeping, or they could kind of, on the converse side, have some depressed moods, symptoms such as sadness or irritability. They might be fatigued. They might be reporting a lot more sleep than usual, taking naps throughout the day, and generally have a lack of energy.
Wow. I mean, that can get confusing, right? Because sometimes teenagers just go through those phases anyway, right? But it's that's really valuable.
Yeah, there's a joke that we have that every adolescent or teenager kind of acts concussed all the time, right? So my 17-year-old daughter, hopefully she's not going to listen to the podcast. Any day she could be exhibiting some of these symptoms, and you bring up a really good point. It's important to make sure that these symptoms are related to the injury itself, that they've occurred following the injury, that they weren't there before, and that you really consider, was there a clear mechanism of injury from the concussion that led to those symptoms.
Gotcha. And are there certain athletes or maybe certain personality types that are more at risk for mental health issues following a concussion?
Sure. Concussion, again, kind of fights dirty, and it often picks on the low-hanging fruit. It can involve, more than one type of profile. But the anxiety mood profile is actually an interesting one, because it's associated with things like a previous, psychiatric diagnosis, so anxiety or a mood disorder, something like that. But it can also be associated with other, pre-existing conditions such as migraine. A lot of folks that have migraine history are more likely to have anxiety mood because they're constantly concerned about when their next migraine may come on, and they're sort of fearful of that. And that can certainly relate to, a similar outcome following concussion. There are also just a whole bunch of other factors, such as being a somaticizer, or someone who has a lot of physical complaints. They're kind of more sensitive to their body and how it feels. Being female, being adolescent, both of those place individuals at risk for anxiety, mood, and not having high resilience. And an interesting one for kids and adolescents is having parents who overparent, that are kind of answering the questions for the kids in the exam room and kind of, really running their lives a little bit more. That we see a little bit more mental health issues with those kids.
With helicopter parents.
Yep.
Right.
Exactly.
Is that the right term? Yeah. Outside of the domain of anxiety mood, are there other mental health issues that may follow a concussion?
Sure. And what we see is, first of all, we see sort of a connection between anxiety, mood, and other types of injuries or other types of concussions, such as vestibular and migraine, headache. And so right there, can kind of makes a real complex circuitry. There's a lot of shared circuitry in the brain for the vestibular system and the anxiety arousal system. So oftentimes those co-occur. And then migraine symptoms really create a lot of anxiety, as I mentioned earlier.
Yeah.
And athletes can kind of have a lot of these things going on concurrently with anxiety mood. So they oftentimes will sort of co-occur in these athletes.
And if an athlete is indeed experiencing mental health issues following a concussion, what's their strategy? What's their next step?
I think it's first and foremost is to acknowledge and be aware and have the insight that, hey, I'm not right with regard to my mental health. And in this day and age, we have a lot more athletes coming out with mental health issues. And I think that's helped to encourage athletes to let healthcare providers and those around them, family members, teammates, maybe coaches, athletic trainers, let them know, hey, I'm not right. I had this injury. I seem to be okay with these things, but mental health wise, maybe I need some treatment, some interventions. And, the quicker they do that, the faster they'll recover and the less complicated their recovery will be. And frankly, athletes and coaches around an athlete who maybe is reticent to say that should really encourage them to do so, to seek care and to get the help that they would need.
And Dr. Kontos, so when somebody receives a concussion, is there a certain way the head is hit specifically? Is it front? Is it back? Does it have to be hit just the right way? Like, what's the physical dynamics that normally leads to a concussion? Any number of the 5 that you mentioned?
Yeah, it's a really fascinating question, and we've all, longed to have a clear-cut answer. If you get hit this way, you're going to have these symptoms. But we see time and time again that patients can get hit similarly and have different constellations of symptoms based on, again, what they bring to the table, what happens right after the injury, etc. That said, we do see a little bit more ocular vision disturbance when there's an occipital lobe, so the back of the head involvement, like when an athlete were, to fall back and hit their head, or a boxer might get knocked out and hit their head on the back of the mat, that sort of thing. With vestibular, more often than not, there's a rotational component where there's like a twisting, but not always. And so again, there's not a clear-cut pathway between this mechanism, this concussion looked this way, and so therefore you're going to have these exact symptoms. It just unfortunately doesn't work that way for each athlete.
Got it. So you could be hit anywhere in the head, front, back, side, and even base of the neck, and still experience a concussion, correct?
Yeah, or you could be a quarterback who gets tackled around the waist, but there's like a whiplash injury.
Okay.
You don't even get hit in the helmet or the head, but the movement of the brain inside the skull causes it to be damaged, and as a result you still have a concussion even though there was no direct contact to the head.
And you mentioned boxing before. Which sports do you see the most concussions occur?
Yeah, and boxing of course is unique. I boxed a long time ago as a high school aged individual, and until my mom found out, and then I had to quit. But at the end of the day, boxing, you're trying to knock the other person out, so there's a high potential risk there for concussion, of course. But some of the sports we don't think about that have high risk, and some we don't even know what the risk is, and those include things like horseback riding, and things like skateboarding and snowboarding and skiing, where we see a lot of concussions, but because they're not an organized sport, often they're not sort of categorized or quantified in the same way. With regard to team sports, certainly American football, ice hockey are up there at the top. For women, soccer, we see that, and certainly ice hockey. And there are other sports with some risk, like lacrosse and basketball and things like this. But again, once you get down from the collision sports and you start moving down, the risk kind of goes a little bit away, but it's not completely gone ever, of course. And there are also combative sports, which we are seeing more and more, like MMA, wrestling. There's certainly a risk for concussion in those sports as well.
Gotcha. You mentioned women's soccer. Let's pivot a little bit and talk about, because I assume a lot of the data comes from disproportionately male-oriented data in sports. Correct me if I'm wrong on that, but let's talk about female injuries. Are they just as susceptible? Are there differences between men and women when it comes to concussions?
Yeah, the short answer to this is, females report more symptoms, more impairments, and seem to be at greater risk for concussion in the same sports. So the rate of injury for girls soccer, is higher than it is for boys soccer for concussion. There's a lot of debate about why that is, and there's not a lot of good science behind that. And so what we're learning, though, is females, certainly from a mental health perspective, they're reporting more anxiety, more mood symptoms following concussion. But what we just reported actually in a conference in Ireland this past week at the IBIA conference, the World Brain Congress, really focused on looking at which females, report anxiety symptoms post-concussion. And what we found is it's not all females. And in fact, what we concluded from our research is that early maturing females represent the majority of persistent anxiety following concussion. So there's an interaction between, sex and frankly, adolescent development here, whereas males and females who are normal maturing or late maturing, actually, they report some anxiety post-concussion, but it doesn't persist. It kind of goes back to normal fairly soon thereafter. In contrast, those early maturing females have this persistent anxiety that really is persisting all the way out, sometimes to, 2-3 months post-injury.
Very interesting. So let's say then you're a parent, you're a coach, you're an aunt, you're an uncle, and you have an athlete who is concussed. What can we do? What can the support people in their lives do if they do experience issues such as anxiety, depression following a concussion?
Yeah, I think first and foremost is the acknowledgement, awareness, and insight, and then seeking, clinical care. Not hoping it goes away, not hoping it gets better on its own, not expecting that to happen, but rather taking an active role and saying, hey, I'm not getting better, or my son or daughter isn't getting better. They have these persistent anxiety, mood-related symptoms. I think they need some help here. And so dealing with those mental health issues starts then, clinically with a strong behavioral management base. And by that, I mean getting these kids or adults active with exercise. And, we believe it's okay to provoke a little symptoms following injury. And research shows that it's safe to do that.
Well, what does that mean, provoke symptoms?
Yeah. So let's say somebody has a headache and they start exercising following their concussion. It's okay if their headache gets a little bit worse, but you don't want it to get demonstrably worse to where they're clutching their head. Yeah. So we use the rule of thumb of an increase of 2 in their symptoms is okay. But anything beyond that, we would say maybe we should bring it back down. But again, that's not evidence-based yet. We're doing research right now to hopefully develop that. But the key is being active early, making sure they get regulated and good sleep, managing stress. Nutrition and hydration are also key, but really the key is being consistent and having a routine which gets disrupted following the injury. And then the second part, so once that base of the pyramid is built, the next part to build is really getting interventions that are active and targeted. So, if I have anxiety, mood, I'm going to maybe want to be referred to the psychiatrist and start cognitive behavioral therapy, or CBT as it's called. And maybe medications are warranted, although, we kind of go there as more of a last resort after other strategies haven't worked, more conservative strategies. But what we don't want is athletes or their parents or others around them thinking that, being passive and just kind of taking a wait and see approach is going to be the best, because we know that rest actually will exacerbate anxiety and mood related symptoms. And, it gives too much time for the athlete and individual to think about their injury.
We used to, probably not so long ago, encourage rest after a concussion, correct?
Yeah. And in fact, it's still listed on a lot of what we call consensus documents or guidelines for treating this injury, where, it says to really rest. And if you go online, you'll see tons of claims that you need to rest and not use your phone and not exercise and not do anything. And, try to tell an adolescent to become completely physically inactive when they've been doing a sport and then not to use their phone. That's going to have an adverse effect on their recovery. And so, we've moved now to where at the very first moment you're injured, we don't want to reintroduce the potential for another injury. So we will remove you from play and potential injury, and then follow up and make sure that you're okay. You're not going to take someone from I'm concussed to run on the treadmill right now. But you're definitely going to minimize the amount of rest and focus on getting them active as soon as possible.
And dovetailing off that, and final question is, what do we know about concussions now that we didn't know generally, let's say 20 years or a generation ago, aside from the one that you just highlighted? Is there other information we now know that we didn't know back then?
Yeah, if we went back 20 years ago, concussions were essentially symptoms and cognitive, impairment, and that was it. We didn't look at vision. We didn't look at vestibular. We've developed tools like the vestibular ocular motor screening tool here at the University of Pittsburgh that now is kind of one of the standard tools used to evaluate those systems. And we know that 30% of concussions involve those symptoms, and we weren't even looking at that 20 years ago. In fact, even 15 years ago, we weren't looking at that. And the mental health side has really lately been a real focus too, which is something that we're more and more focusing on. But again, that has only been in the last 5 to 10 years that there's been an emphasis on that.
Gotcha. Well, I don't want to take up any more of your time, and I don't want to give away the whole ship, right? Because you're going to be presenting at our conference coming up shortly. And so if you want to see Dr. Anthony Kontos speak, he'll be speaking at the Greater New York American College of Sports Medicine's conference titled Organized Sports in Crisis, Mental Health Outcomes from Sports Participation. That conference is coming up on April 22nd, 2023, hosted by NYU Langone. And if you want more information, just go to the ACSM.org website, look for the Greater New York Regional Chapter tab, and you could find out information about that conference there. Anthony, thank you so much for your time. I look forward to seeing you at the conference. And do you have any final words?
Thanks, James. It was a pleasure to talk with you, and look forward to being there in New York in April. And honestly, the final word is really, the key to this injury is seeking care early, acknowledging it, and also making sure that you get in and get appropriate care so that we can minimize the potential for these downstream issues that might persist, such as the mental health issues we discussed today.
Awesome. Great advice. Anthony, thank you again for your time, and we'll see you at the conference.
Thanks, James. Goodbye.